Okay, I think we'll go ahead and get started. Good morning and welcome to Healthcare Partners Medicare 101. My name is Nicole King and I'm the Director of Broker and Community Relations at Healthcare Partners. Our team typically hosts and attends in-person events to connect with our Southern Nevada community and share the exciting things that we're doing as an organization to care for our patients. Although we're not currently able to connect with you in person, we're thrilled to have launched virtual events to connect with you from the comfort of your home. We appreciate you joining us today to learn a bit more about Medicare. Before I introduce Jade Jones, I'd like to share a bit about Healthcare Partners Nevada and our unique My Generation Senior Clinic concept. So Healthcare Partners Nevada is a provider network here in town. We have nearly 300 primary care providers at more than 100 primary care locations. I mentioned our unique My Generation Senior Clinic model. These clinics were designed specifically for our Medicare Advantage patients, and I'll give you a little bit more information about that in a moment. We do also have specialists within our network, urgent care and walk-in centers, and we are affiliated or partnered with 20 hospitals here in the Valley. We also have 24/7 access for virtual care through Teladoc, and we've also actually included virtual care with our providers recently due to the COVID-19 pandemic. So our My Generation Senior Clinics, I mentioned that they were specifically designed for our Medicare Advantage patients to deliver a concierge-style level of care. You can see we have amazing access standards at these locations, 2 weeks for new patients and 2 days for established. We also have same-day access for any urgent care needs, in addition to that 24/7, 365 virtual care access. The great thing about these locations is we have fewer patients assigned to each provider, so you actually get more time with your assigned primary care provider. Our average appointment length is 30 minutes, which is double the average appointment length. We also have additional care team members at these locations like care managers and navigators. We have a dedicated referral team to help process referrals to specialists. And some locations even have on-site labs, so it's really a one-stop shop for your healthcare needs. So currently we have 27 clinics open. We had hoped to open 3 more new locations during the early part of 2020, but with the pandemic that has hit our town, things have changed a bit in terms of timeline, but we have 3 new locations that will be opening up by the end of the summer. You can see the blue stars showing one in the north part of town, one near Summerlin, and then one off the Blue Diamond in the Blue Diamond area. Our Blue Diamond location is actually opening up a week from Tuesday on May 26th. So if you live in that area, Dr. Roy Perlow would love to welcome you to his practice and help care for your healthcare needs. So with that, I would like to turn it over to Jade Jones to help walk us through the Medicare 101.
Thank you, Nicole. Excuse me, I appreciate it. Thank you for the opportunity today. So today, yes, we're going to go on and go over Medicare and Medicare one-on-one and basically go over the basic needs of what Medicare has to offer. So yes, my name is Jade Jones and I am a local broker here in Las Vegas, Nevada. I've been doing Medicare insurance for about almost 10 years now. I do offer plans that Healthcare Partners and My Gen clinics do accept. So at the end, if you have any additional questions, here's my contact information. You can always give me a call. You can always email me, whatever's best for you. And at the end, I will show my information as well once again. So let's get started. So who can get Medicare? When it comes to Medicare, you must always meet the requirements. You must be 65 and older, younger than 65 with a qualifying disability, or any age with diagnosis of end-stage renal or ALS. You have to be a legal resident within the United States at least 5 years or more. And if you're not, there are additional ways that you can get Medicare, and we can go over that as well. What does Medicare cover, and the cost? So when it comes to Medicare, you have it covers Part A and Part B, which is hospital medical services. What that means is Part A covers anything inpatient hospital, from skilled nursing to staying in the hospital. Anything that's covered within the hospital, if you're having surgery, having to take medications, as well as hospice care. When it comes to Part B, that is your medical portion of Medicare. That'll cover from doctors, that'll cover from doctors, ambulance services, outpatient surgeries, things like that. And we'll get a little more of a detail. Like I was saying, when it comes to Part A, it covers hospital. For example, skilled nursing facilities, inpatient care, x-rays, lab services that is dealt with within the hospital, hospice care, like I said. When it comes to Part A, you don't typically have a premium that you're going to pay for Part A. There is a deductible. If you do happen to, step foot in the hospital and you are staying overnight, it is $1,408 per benefit period, and that's up to 60 days. Your other cost is $341 per day for 61 to 90 days. And then from there, per lifetime reserve day, the maximum of 60 days is $704. There is no out-of-pocket limit when it comes to Part A. So yes, you just advise you just keep on. You come out the hospital, you go back in. This starts all over when it comes to the deductible. Part B, like I said before, it covers doctor visits. It covers mental health services, durable medical, ambulance services, x-rays, MRIs, things like that. When it comes to Part B, yes, you do have a premium. Your premium for 2020 is at $144.60. Now, depending on your income level, it can go up. If you have assistance to the state, you can possibly have that reimbursed to you. But at this time, the premium for Part B is $144.60 per month. There is a deductible for Part B, and that's $198 per year. So once that's met, you will pay 20% of the cost for all of your medical services. There is no out-of-pocket limit, so you will continue to pay if there's a catastrophic year. Medicare does not cover everything. So when it comes to original Medicare, you're just having only your hospital medical services covered. It does not cover prescriptions. It does not cover routine dental, vision, hearing care, long-term services, and a few other things. Where could you get that coverage? So you have two different options, or a few, should I say. When it comes to Medicare, you have option one, where you can add a Medicare supplement plan with a Medicare Part D plan. A Medicare supplement plan helps pay some of the out-of-pocket costs that comes from original Medicare. What that means is throughout Medicare, you're paying that 20% for that hospital medical services. Medicare is paying the 80%. If you add a supplement plan, it'll help towards that 20%. But remember, it does not cover a prescription drug plan, and it's mandatory to have one, so you have to add a standalone Part D prescription drug plan. Your other option is a Medicare Advantage plan. A Medicare Advantage plan combines Part A and Part B all under one plan. It also includes typically a Part D prescription drug plan, and it may offer additional services as well. So those are your two main options. Medicare supplement plans, like I said, cover most of Part A and Part B services and deductibles. Excuse me. You cannot use a Medicare Advantage plan and a supplement plan. It's either or. When it comes to Medicare supplement plans, they have 10 different plans that you can choose from, and it is offered through private insurance companies. When it comes to Medicare supplement plans, like I said before, you don't have prescriptions. It doesn't come with prescriptions. It doesn't assist you with dental or vision It doesn't include custodial long-term care. Now, what it might have is deductibles depending on one of those 10 plans you decided to choose from. It also might have some co-payments, some co-insurance, and some excess charges. So you definitely want to get with me, and we can look over those 10 different plans to see what best fits you when it comes to one of those, or look at a Medicare Advantage plan. When it comes to a prescription drug plan, you can always have it as a standalone with your Medicare and supplement plan, or you can always have it with your Medicare Advantage plan. Like I said before, most Medicare Advantage plans include a Part D prescription drug plan at no additional cost. When it comes to a prescription drug plan, they're also offered by private insurance companies. Prescription drug plans. So it if you have it as a standalone prescription drug plan, most of those particular plans might have a deductible, just as well if you have a Medicare Advantage plan as well, depending on what plan you choose from. So when it comes to your Part D plan, you have deductible. You'll pay the full cost of your prescriptions until it hits the certain amount. Once you hit that amount, you're now in the initial coverage where you're paying a copayment, the insurance company is paying that copayment. When those copayments combine together, which is the actual retail cost, starts to add up to $4,020 throughout the year, you now fall into something called the coverage gap, the donut hole. When you fall into the coverage gap, the donut hole, after you've met the $20, you now have to pay 25% of the cost for all of your generics and brand name prescriptions. That amount, you now fall into the catastrophic coverage. Once you hit the catastrophic coverage of $6,350, you now will pay for the rest of the year small co-payments and co-insurance for those prescriptions. Now you might say, well, how would I know, Jade? Well, that's one thing that I do as a broker is I go over your prescriptions and see what plan fits you best. Because if you are diabetic, heart, lung conditions, there are certain plans that might fit your needs that might bring down the cost of those certain prescriptions if you hit the coverage gap. And I could definitely go over that with you. Just as well, when it comes to the coverage gap, the insurance companies every month will send you a statement showing where you stand with your prescriptions and letting you know if you're getting close to the coverage gap or not. So we can always go over that information because that's very detailed information that you should understand when it comes to your prescriptions. We don't want you to be shocked when that comes about. So Medicare Advantage plans. Medicare Advantage plans is Part C of Medicare. A is for hospital, B is for medical, C is for Medicare Advantage plans, D is for prescription drugs. So Part C combines A and B, and it also typically includes a Part D prescription drug plan and offers additional benefits provided by original Medicare, not provided by original Medicare. Medicare Advantage plans, another way to get your Medicare benefits. Is an alternative than original Medicare. So instead of just having straight Part A and B by itself, you can add the Medicare Advantage plan with that. Medicare never goes away. It just steps to the side, and that insurance company that you've chosen basically administrates all of the Medicare benefits. Plan members are still part of Medicare program. Benefits are administrated by the plan. Plans offered by private insurance companies. So Medicare Advantage. All Medicare Advantage plans are covered. They cover all of Part A and Part B services, and they also include Part D prescription drugs. But remember, like I said, depending on certain conditions, you might want to shop around and see what Medicare Advantage plan is best for your needs, especially when it comes to prescriptions. Because like I said, you can possibly have your prescriptions a little more reasonable on certain plans depending. Medicare Advantage plans may offer additional benefits such as dental, cleanings and x-rays, eye exams, corrective lenses, hearing tests, wellness programs, and memberships. Medicare Advantage plans have an annual out-of-pocket max. So what that means is when it comes to straight Medicare, there is no max out-of-pocket. You're going to keep paying and paying and paying for your hospital medical services throughout the year and of 20% of the cost. When you have a Medicare Advantage plan, the insurance company gives you a certain amount throughout the year. And if that amount is met throughout the year for your hospital medical services, the plan is covered at 100% for that portion, and you won't pay any more or less. Unlike original Medicare, you will keep paying. Medicare Advantage plan types. So you have health maintenance organization plans, which I'm sure you've heard of, HMOs. Preferred provider organization plans, which are typically PPOs. Then you have point of service, special needs, and then private fee for service, and then medical savings account plans. Mostly here in Clark County, we focus on HMOs, PPOs, and SNP plans. When it comes to a health maintenance organization plan, HMOs, you basically have your primary doctor, healthcare partners, and healthcare partners will refer you out to their specialists. When it comes to PPO plan, You have the freedom to go and choose wherever you like when it comes to doctors, but you definitely pay a little more for that freedom. Special needs plans or chronic illness plans for people who are diabetic, heart, lung, and just as well as kidney. So, Medicare Supplement versus Medicare Advantage plan. Why would you choose either or? So this is a little graph that'll kind of show you when it comes to Medicare Supplement, the coverage you'll pay some costs not paid by original Medicare. You does not help with drug costs and nationwide coverage versus the Medicare Advantage plan. It provides benefits of original Medicare and beyond, often includes drug coverage, may have provider network. The cost on a Medicare supplement plan, monthly plan premiums, drug plan premium, other costs added. So if you have a Medicare supplement plan, you have the premium to pay, plus that Part B premium, as well as a prescription drug. When you have a Medicare Advantage plan, may charge plan premium. Most plans are zero. There's some plans that do have a premium, but when it comes to a Medicare Advantage plan, your hospital, your medical, and your prescriptions are all under one plan. So you don't have anything additional to pay. And when it comes to Medicare Advantage plans, the co-payments and co-insurance for most covered services are within that annual max out-of-pocket. So it's kind of like having an a la carte on a supplement plan because you have your Medicare, your supplement, and Part D. When a Medicare Advantage plan, you'll have just one card, not 3 different cards. So it's kind of easier to keep up with. Alrighty. When can I enroll in election periods? So when it comes to Medicare, if you're turning 65, you have 3 months before or 3 months after to enroll in Medicare. So if you're already accepting Social Security, Medicare will already send you out your card right before those 3 months get started, so you can start shopping. But let's say you're not collecting Social Security, then you want to get in touch with Social Security so they can so you can activate your Part B and get everything started so you can look into a Medicare Advantage or supplement plan. You can also delay Part B if you're still working and have group coverage with your job. That's where you always want to get with someone like myself and see, is it best to go with go with my group insurance and stay where I am, or drop that and go on Medicare? And if the group insurance is a better way to go, that's fine. Continue where you're at and don't add Part B until you drop that group insurance, because you definitely want to always have some type of coverage so you're not penalized. Special enrollment period, working past 65. So if you're working and you decide, okay, I want to retire, you're welcome to do so. And when you do, you have a certain period of time, 8 months, to enroll in Part A and Part B. Now, if you're wanting a Part C and D plan, you have that 2 months. So basically, you have almost 2 months if you want a Medicare Advantage plan. Late enrollment penalties, the fun part. So when it comes to Part A, they typically already enroll you in Part A if you worked a certain amount of credits. But if you're wanting to get Part A and you didn't work those credits, then yes, you will have to pay that penalty fee. When Part B happens, you do have a penalty if you don't sign up at the times that is given to you. You do have to pay 10% for each full 12-month period. Part D, you have to pay a 1% current average premium for each month. Typically for Part D, the only way that you can get out paying that is if you have credible coverage through your group insurance, for example, or VA. There's a few others as well that you can choose from. But you always want to talk to someone when you're receiving your Medicare for the first time so you can avoid any of these penalties. Where can I change my coverage? So you're on a Medicare Advantage plan right now, but you're not too happy. You want to think about changing. Can you? As of right now, depending if you have a special election period, you might not be able to. And if you're not able to, you're not stuck. You just have to wait through the annual enrollment period, which is between October 15th to December 7th. That's where you can make your changes for your Medicare. Your new plan won't start till January 1st the following year. Medicare Advantage open enrollment. What this means is throughout the Medicare open enrollment period, you chose a plan, you realize in January, I'm not happy. Are you able to stay on that plan? you can actually switch off. Between January 1st and March 31st, you have another few months to make another decision and switch plans. Now, you can only switch one time during this particular time versus during the annual enrollment period, you can switch as many times as you choose. But during the open enrollment period, you can only switch once, and it has to be from a Medicare Advantage plan to another Medicare Advantage plan or back to original Medicare. So just to advise you. Special enrollment periods qualify events. So when it comes to special enrollment periods, that's when you're out of the annual enrollment period. That's when you're out of the open enrollment. We're actually in it right now. So what that means is let's say you're moving to California and you say, hey, Jade, I'm moving. What's going to happen? So now you have a special election because you're moving to a different county. Once you move, you can switch to a new plan within that county. If you have assistance through the state, LIS, extra help, LIS is low income subsidy. If you have those special elections, then yes, you can actually change throughout the year a few times. You can also move if you moved, if you left your company. There's a few different type of special elections that will be able to assist you throughout the year with changing your plan if you need to. Where could you go for help? So for more resources, you can visit Medicare.gov. You can always call Medicare. They're open 24 hours a day, 7 days a week. They have a lot of great information they can give you. Call your state health insurance assistant program. I like that. I always refer people as well because they'll give you a breakdown of all the companies. And then contact your local Social Security office or state Medicaid. You always want to try to call Medicaid to see if you qualify for assistance because you might get assistance for that Part B premium of $144 for your prescriptions and possibly for your hospital medical services co-payments. Speaking of that, financial assistance program. So like I said, SHIP can help direct you. Extra help, Medicaid. Extra help is only for the prescriptions portion. And Medicaid, they can help to see if you qualify for more than just the prescriptions. Medicare Savings Program, and then programs for all-inclusive care for the elderly. Once again, my name is Jade Jones. I appreciate anyone who is listening today, and if you have any questions, here's my contact information. I'll be excited to hear from you. I am doing most of my appointments virtually now through the internet. So feel free to give me a call. We can always set something up or we can talk face to face through the internet. Thank you. And you guys have a great day. And if you have any questions, here I am to answer.
Thank you so much, Jade. Really appreciate it. That was very helpful and informative. And we hope the attendees on the line found this information valuable. We do have a chat feature. And I do see that we have one question submitted. The question was regarding the Part D prescription coverage. It was, if they don't want Part D, can they go without that?
Well, when it comes to Part D, if you have credible coverage, like for example, you go to the VA to get your prescriptions, then that's on you if you decide not to elect in getting a Part D plan because you'll have the credible coverage to get it through the VA. But if you don't have that, if you're not able to do that, then yes, you have to have a Part D plan. It is by law. In 2006, the government put in place that you have to have a prescription drug plan. So either you get it from a Medicare Advantage plan or standalone, but you definitely want to have a Part D. And if you decide to say no to it, and then 5 years down the line, you would like to have a Part D, you now will be penalized. And when you're penalized, that penalty is not just a one-time penalty. You will be penalized and you have to pay that monthly penalty for the rest of your life.
Okay, that's great feedback. Thank you. So for those other attendees that would like to submit a question, we do have a chat feature. You should see a little chat bubble if you'd like to submit a question. We have the Medicare expert here on the line to help address any of those questions you may have. So we'll just kind of hang tight for a minute, see if anybody else has questions, and then we can go ahead and wrap up for the day.
Okay, thank you.
So last call for questions. Anything else we can help address?
Say that one more time.
I was just asking the attendees if anybody else had any questions. I'm not seeing anything else come in. So what I can let everybody know is, we're hosting virtual events each week. We have everything from doc talks and fitness classes that you can take from home. We also have Medicare 101s where we invite the licensed insurance agent to come speak on Medicare. So please visit our website, hcpnv.com, and check out our events page. Like I said, we're hosting several events each week, and we really hope to see you at a future event. So thank you to Jade for joining us today. We really appreciate it.
Thank you for having me.
You're welcome. And, for all the attendees, thanks for joining us today and spending a bit of your Friday with us. We hope you found this valuable and informative and hope to see you at a future event. Happy Friday and stay safe.
Thank you. Have a good day. Bye-bye.